Ep 54, Sleep Apnea in Seniors, Signs, Risks, and Solutions. You wake up exhausted after 8 hours of sleep. You fall asleep in the chair after lunch. Your partner complains about your snoring or worse, tells you that sometimes you stop breathing in the night. You have morning headaches. Your concentration is poor. You feel low and irritable. These are the classic signs of sleep apnea, one of the most common and most underdiagnosed conditions in older adults, affecting up to 60% of adults over 65 in some studies. And it is not just a nuisance. Untreated sleep apnea doubles the risk of cardiovascular disease, triples the risk of type 2 diabetes, significantly increases stroke risk, accelerates cognitive decline, causes depression, and dramatically reduces quality of life. Today, we're covering what sleep apnea is, how to recognize it, and the solutions that genuinely work. Sleep apnea is characterized by repeated pauses in breathing during sleep, each pause lasting 10 seconds or longer, followed by a partial awakening as the brain detects the oxygen drop and rouses the body enough to resume breathing. Obstructive sleep apnea, by far the most common type, occurs when the soft tissues of the throat relax and collapse during sleep, blocking the airway. The chest continues to try to breathe, but air cannot pass. Central sleep apnea involves the brain failing to send the correct signals to the breathing muscles. These events, called apneas and hypopneas, can occur dozens or even hundreds of times per night. Each one causes a brief partial awakening, even if the person is unaware of it. The result is profoundly fragmented sleep architecture, with virtually no time spent in the deep and REM sleep stages where physical and cognitive restoration occur. The severity is measured by the apnea-hypopnea index, AHI, the average number of events per hour. An AHI above 5 is abnormal, above 30 is severe. Sleep apnea becomes significantly more common with age. Several factors drive this. Upper airway muscle tone decreases with age. Fat deposits around the neck increase airway resistance. Hormonal changes, particularly postmenopausal in women, remove a protective effect. Weight gain around the neck and abdomen is a major driver. Risk factors include obesity, particularly central adiposity, male sex, though the gap narrows significantly after menopause, neck circumference above 40 cm in women or 43 cm in men, structural features, a receding jaw, large tonsils, a narrow airway, alcohol consumption, which relaxes throat muscles, sedative and hypnotic medications, and nasal congestion. Signs to watch for: loud snoring, particularly with gasping or choking sounds, witnessed breathing pauses, a partner is often the first to notice, waking unrefreshed despite adequate time in bed, morning headaches, excessive daytime sleepiness, poor concentration and memory, irritability or depression, and frequent nighttime urination, noxuria, which is often caused by the negative pressure effects of apnea on cardiac filling. Diagnosis requires a sleep study, either a home sleep apnea test or a full in-laboratory polysomnography. Both measure breathing patterns, oxygen levels, and sleep stages. Home sleep tests are now widely available, convenient, and reliable for diagnosing obstructive sleep apnea in most adults. A device worn overnight measures airflow, chest movement, and blood oxygen. Results are analyzed by a sleep physician. If you recognize the symptoms, particularly if a partner has witnessed breathing pauses, ask your doctor for a sleep apnea assessment. This is one of the most important referrals a doctor can make for an older patient. CPAP, continuous positive airway pressure, is the gold standard treatment for moderate to severe sleep apnea. A machine delivers a continuous stream of air through a mask, maintaining positive pressure in the airway and preventing collapse. Modern CPAP machines are quiet, compact, and far more comfortable than earlier generations. Auto-adjusting CPAP, a PAP, automatically varies pressure throughout the night based on real-time breathing patterns, improving comfort. A wide range of mask styles, nasal pillows, nasal masks, full face, allow personalization. The benefits of effective CPAP treatment are dramatic: elimination of apneas, restoration of normal sleep architecture, resolution of daytime sleepiness, significant reduction in cardiovascular risk, improved blood pressure control, better blood sugar levels in diabetics, and marked cognitive improvement. The main challenge is adherence. Initial discomfort with mask wearing requires a break-in period. A sleep technician or respiratory therapist can assist with mask fitting and troubleshooting. For those who cannot tolerate CPAP, several effective alternatives exist. Mandibular advancement devices, custom-fitted oral appliances made by a dentist, reposition the lower jaw forward during sleep, opening the airway. They are less effective than CPAP for severe apnea, but well tolerated and effective for mild to moderate cases. Positional therapy. For position-dependent OSA, apnea that occurs only or predominantly in backsleeping, avoiding supine sleep using specialized pillows or positional alarms can be highly effective and requires no device. Weight loss of 10 to 15% of body weight reduces AHI by approximately 30 to 40% in overweight individuals with OSA, sometimes enough to resolve moderate apnea entirely. Surgical options, including nasal surgery to correct structural obstruction and hypoglossal nerve stimulation, an implantable device that activates the tongue muscles during sleep, are available for selected patients. If you are tired despite sleeping enough, if you snore, if your partner has noticed pauses in your breathing, please ask your doctor about sleep apnea. It is common, it is diagnosable with a simple overnight test, and it is treatable. The transformation that effective sleep apnea treatment produces in energy, cognitive function, mood, and cardiovascular health is one of the most dramatic improvements any medical intervention can deliver. See you in the next video.